5 million people bitten by snakes annually. Of this, 2 million develop clinical illness and 138,000 die from complications. And as Elizabeth Atieno reports, although antivenoms are just life-saving and can spare patients some of the suffering caused by necrotic and other toxins in snake venom, this silver bullet is very expensive and the social health insurance cover for the same is proven to be inadequate.
A sudden lash of movement, followed by a sharp hiss, is cut short by the velocity of a piercing attack. This is the lived reality for approximately 20,000 Kenyans bitten by venomous snakes every year. For Pius Murithi, this was a nightmare he longs to forget.
On that day, I had gone to see a friend at around 10 p.m. As I was walking, I felt a bite, and my phone was off, so I couldn't even see. After a few minutes, I started bleeding. It started very little, but increased with time. I came back home with a lot of pain, which was spreading even to the neck. I was taken to a hospital in Murundiko, where I was treated. Then they called an ambulance that took me to Kimbimbi Hospital, where I was admitted for a week.
Snake bites claim the lives of approximately 4,000 Kenyans annually, while leaving about 7,000 others with permanent disability.
Sana sana hizo nyoka zikikuja, zinakujaga kukura, zinatafutanga mayai ya kuku ama vifaranga ya kuku. Wakati kumekauka sana, zinakujaga kutafuta maji.
There were 700 snake bite cases that had been recorded at the facility level. And those three counties are Kajiado, Vihiga, and Kakamega.
The rising snake bite statistics come at a time when the country is grappling with a shortage of antivenom. The situation now highlights the urgent need for Kenya to invest in the local manufacture of antivenoms, which are currently imported from Europe and India.
In Kenya, we only have, I think, 2 or so pre-qualified antivenom, and they are generally broad spectrum, so they can treat most of the venomous bites.
So the mandate that we've been given is to produce a local antivenom that will be more or will work better compared to the antivenoms that we have had, and will work and will be more affordable and reachable and within reach to our communities.
The Kenyan government spends approximately 1 billion Kenya shillings annually importing antivenom, while the Kenya Wildlife Service is expected to spend about 5 billion Kenya shillings every year compensating victims of snake bites.
Importing the antivenom might be relatively expensive because not many people are manufacturing it. And the reason is because there are really not much profit to be made from antivenom.
It seems that after this study, it will also enlighten on how we are going to approach the prevention, the management, and even the procurement of the snake antivenom in Kirinyaga County.
The World Health Organization aims to reduce snake bite cases and related deaths by 50% by 2030 through improved access to safe and effective antivenom treatment.
One of the biggest success stories of the work we have done is in Kakamega County, where they actually have instructed level 4 facilities to purchase antivenom from their facility improvement funds. So if you go to Kakamega, every single level 4 facility has antivenom and they are offering it free of charge.
Counties that recorded high cases of snake bites include Kilifi, Kitui, Isiolo, Baringo, Machakos, Marsabit, Taita Taveta, and Garissa. Health stakeholders have reiterated the importance of the 107,000 community health promoters spread across the country in providing first aid and guiding victims to seek urgent medical attention.
Kwa hivyo tumeambiwa kama ni clearing the ground, tumeambiwa tuendelee kuwa ground zetu ziwe ni safi.
Contrary to popular opinion, do not tie the bite site. I know many people imagine that you need to tie your leg or your limb so that the venom does not travel up the bloodstream. But that is a very, very dangerous thing to do, because when you tie a limb, you actually cut blood supply to the rest of the other limb that you tied, and that is usually what causes gangrene and amputation of that limb.
Many snakebite victims do not seek treatment at health centers or hospitals. Instead, rely on traditional remedies. The World Health Organization strongly advises against the use of traditional first aid methods or herbal medicines, stating that they lack proven medical benefits, may cause severe physical harm, and can delay access to medical facilities where life-saving antivenom can be administered.
You don't need to cut, you don't need to suck, you don't need to apply ash and blackstone and all those other traditional methods, because the only antidote for a venomous bite is the antivenom itself.
The Social Health Authority SHA covers snake bites in Kenya. However, the emergency benefit is limited to the first 24 hours of stabilization and provides up to 6,600 Kenya shillings for anti-snake venom treatment. This amount remains inadequate considering that a single vial of antivenom can cost approximately 6,000 Kenya shillings, while severe bites may require multiple vials, sometimes up to 20 doses.
For me, my call is that snake bites need to be covered under primary healthcare fund so that anybody going to a dispensary can access the antivenom without having to pay for it.
Kenya, through the Kenya Institute of Primate Research, is now seeking to improve health outcomes for snakebite victims across Africa through the African Snakebite Alliance, which focuses on strengthening scientific research and supporting the local manufacture of anti-venom. Elizabeth Atieno, TV47, Nairobi.
Thank you, Elizabeth Atieno, for that report.